Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we love the sun. Of course, we haven't had too much lately. We do love the sun. That's why we come to South Florida. But we do have a problem with the sun. And so now we have something that's called skin screenings. And, of course, there are skin screenings and there are skin screenings. We want to go to someone who really understands what to look for in a skin screening. And we're so happy that Broward Health North is now going to have it's actually the Broward Health North Comprehensive Cancer Center. They're going to have a free skin screening by none other than Dr. Jason Green, who's a dermatologist whom I know very well. And I'm so happy to hear this. I'm going to give you a date before we even start. It's Wednesday, June 20th from 5 to 6:30 in the evening. And it is free. Very, very important. So I'm welcoming you. I'm going to start putting you on Facebook Live, Dr. Green. And I'm going to ask you, are you ready for that we call it a seminar. It's a screening, but you're going to talk too, I hope.
I absolutely am there to help educate the patients. And I want to thank Broward Health North for having me. Anita, I want to thank you for having me on your show. And we really are here to help the community, help make diagnosis of skin cancers, help prevent skin cancer from growing, from harming anyone, and if we can do any type of prevention, that's what this is all about.
So, Dr. Green, though, what makes your eyes so good? They're very cute, but what makes them so good that you can look at someone and tell that, because you did that with me once, you can just tell that there's a problem. How do you know that?
So I am a board-certified dermatologist practicing in Deerfield Beach who has probably 15 or 16 years of practice behind me. And we were trained, and I'm constantly working every single day looking at patients, looking at lesions. The more we do it, the more we're able to identify lesions of suspicion that are potential precancers, cancers, or even atypical moles. So essentially what we're doing is looking for a very simple concept called the ABCDEs. And this is how we make the diagnosis of lesions that are suspicious. The A stand for asymmetry. If a mole should not look like it should, if it's cut it right down the middle, one side should look exactly like the other. If it doesn't, then that's suspicious. The B stands for borders. The borders are regular versus irregular. The C are colors. It should be one color versus multiple colors. And the diameter should be smaller than 6 millimeters. The E stand for evolving. And this is a question I ask all my patients. Are things changing? Is there something that's changing, bleeding, itching, or growing? And that leads us to be suspicious of the lesion. But like you asked me, I've been doing this for many years. My eyes are trained to look at a lesion, and within a matter of seconds, I can tell you if it looks suspicious or not. And that can help us identify something and catch it early. And if we can catch something early, then we can really make a significant impact on someone's life.
So when you go to parties, and, they know you're a dermatologist, they probably get very close to your face and say, so, doctor, do I have anything that doesn't look good?
I do my best not to practice dermatology at parties.
But
Otherwise,
happens.
I'd have to ask a person to please undress completely, and then I can thoroughly look them over,
right.
As we're going to be doing at the skin cancer screening at Broward Health North.
That's what I wanted to ask you. So how does that work? Do the people make appointments?
So they're going to call up the hospital. It's at the cancer center. It's going to be, like you said, at 5 p.m. to 6:30 p.m. on Wednesday, June 20th. And they're going to schedule for a free skin cancer screening. What this means is they'll come for an appointment. They'll see me. I'm going to look them over top to bottom, thoroughly looking over their skin to make sure there's nothing that I consider suspicious, meaning skin cancers, precancers, atypical moles, anything that can be harmful to a person.
Yeah, and let me give everyone the number. Remember, this is Pencil Talk Radio. Get your number here. It's 954-759-7400. Again, 954-759-7400. Or you can go to their website, browardhealth.org/events. They have a lot of events there, but this is very important because June is the month, isn't it, for skin cancer?
We're in South Florida, so all the time is the month, but technically May is Skin Cancer Awareness Month or even Melanoma Awareness Month. However, the hospital, Broward Health North, is doing something that's very, very fortunate, very nice, very giving to our community. So we're doing it a little extended beyond May, but we're still here to help patients, help the community, And that's what this is. This is a really quick, easy process that we're doing. It's painless, it's preventative, and it's free. So we're looking out to help the community and find skin cancers and catch things before they become problematic.
We thank you for donating your time. You're very busy. I know that if you go to his beautiful center in Deerfield Beach, you'll see that the doors are swinging in and out. Well, let's talk about skin cancer. Is this hereditary, or who gets skin cancer?
So over half of all cancers diagnosed are skin cancers. So that's huge. If you think about that, all cancers worldwide, over half of them are skin cancers. So is it hereditary? There's always nature versus nurture. So it's what we're doing and how we're living our lives. There is a genetic component to it as well, but the sun exposure is the number one cause of skin cancers. UV damage, whether it's from the actual sun or from tanning beds, but the way people are living their lives and getting exposed to the sun, the ozone, all that factors in, but there are genetics that come into play. If you're a fair-skinned person, a redhead, or you have a family history of melanoma, then you have a higher chance of getting something like this. But our exposure, our life experiences in the sun is what's creating a lot of the problems.
So for those of us who grew up in Miami Beach, as I did, and I had acne, and so I'd get in the sun, and it would disappear because it became a tan. And then, of course, it would come back again. But many of us were in the sun. You know, we never knew about this. This is kind of new, isn't it? I mean, of course, I'm old. But let's say 50 years ago, we didn't talk about this.
So, Anita, just like you, I'm born and raised in South Florida. I was born in Miami Beach as well. I grew up back in the day when the copper tone sign was on 95 and I think it was 163rd Street. And everyone was encouraged to go in the sun. I grew up down here. I have blue eyes, and I am like a skin cancer survivor also. I had a skin cancer on my nose because we used to all go in the sun. We used to bake. People think that looking tan is nice, but it does increase our risk of getting skin cancers. So lifestyle definitely came into play with this kind of stuff. And so hopefully we're trying to educate the population and people, letting them know that wearing sunblock is important. The right sunblock with zinc oxide is very important. Reapplying the sunblock every 2 hours. The worst times to be in the sun are between 9 and 2 or 9 and 4. In Florida, you know, the reality is you can get sun from even earlier than that, all the way up to 6 p.m. at times. So if you're in the sun, you have to protect yourself. Sun protective clothing, hats, long sleeve shirts. We have to protect ourselves from the harmful rays.
Let's talk about how we apply this lotion. All right. How do we do that? I mean, do we slash it, put it all over our face, our arms, and you know, and we're putting it over our makeup or under our makeup? What are we doing?
So the reality is anywhere that's exposed to the sun needs to be protected. Not only do you have to put it on, you have to reapply it every 2 hours. Theoretically, if you're out in a bathing suit, they say the size of a shot glass is the amount of sunblock that you need to put on to cover up your body. The reality is anywhere that's getting sunlight needs to have sunblock on. The sunblock has to be the right sunblock. It has to have the right ingredient, which is zinc oxide or titanium dioxide. People always ask me about the number, but if you have the right ingredient, they'll automatically will have the right number, which is 30 or above. And the benefits that you start getting when you start going with higher numbers are really insignificant compared to just getting a 30. And then plus people don't like the way it feels on the skin when you go above 30. So getting the right sunblock that works for you, that you're going to use, you're going to reapply and cover up the areas, not just the nose, the whole face, the ears. We even find skin cancers in the lips, the hands, the feet, anywhere that's exposed to the sun.
Okay, but now there's certain kind of clothing. You mentioned that, and I know I get a booklet on clothing. So when you go out, you know, if you're going out for doing things, you're not going to put that on. Is it just for walking or going to the beach?
General rule of thumb is if you're outdoors more than 15 minutes, you should have some sunblock on. Ideally, you're supposed to put the sunblock on a half an hour before you go outdoors. And you were asking, when do you put the sunblock on? What do you do with makeup? Sunblock should be the last thing you put on your face or anywhere on your skin before you go in the sun. And ideally, you put it on a half an hour before you go outdoors. In South Florida, people going in pools in the ocean, when you're in the water or you're sweating heavily, it's very common to wipe off the sunblock to come off. Even if it says waterproof, water resistant, it gets wiped off, it gets washed off. So if you're out there, you're sweating, you're playing sports, or you're in the pool or the ocean, the trick is to reapply it when you come out. You
have told us about this, but I wonder about those hats. You know, everyone wears a hat. Some people wear these little hats like tennis hats. What kind of, there is special clothing, I know.
So
too.
There is special clothing. There are special hats, but the reality is if you want to get SPF clothing, they sell them all over the place nowadays. Hats, you want to make sure it covers up the area. It's not like a hat that has like the mesh where the sunlight can come through, because if it can, you're still getting sunlight. And you just want to keep the area covered in a broad-rimmed hat if you want, or even a baseball cap is sufficient. But if the ears are not covered, then you got to put sunblock on those areas. So whether you have clothing protecting you or sunblock protecting you, you need to do something to protect you from the harmful UVA rays and UVB rays.
And especially children. Let's talk about people with their children. I have seen them out there with nothing on. I mean, no block. It's
very hard to change some people's habits if they're already in the sun. However, if you have children, you want to be extra cautious with the children. I have 2 little kids myself, and I see it very common that people do put the long-sleeve sun protective shirts on their kids, the hats on the kids, the sunblock on the kids. If you start a child at an early age getting used to the habit of wearing sunblock and sun protective clothing, then it becomes second nature. It's much easier. So if you're not going to protect yourself, please protect your children. It's important.
And you said something else. So let me just go back over this. This is Dr. Jason Green, and he is a dermatologist, and he is going to do something very good for the community on Wednesday, June the 20th, from 5 to 6:30 in the evening. For free, you're going to be able to get a free skin screen. It's absolutely a wonderful thing that's happening. It's at Broward Health North, and there's that beautiful building, right? You can see as you're on I-95. You go to 201 East Sample Road in Deerfield Beach. If this is the number to call so that you can get you have to make a reservation. 954-759-7400. Again, 954-759-7400. Or you can go on their website, browardhealth.org/events. Let me just say we do have someone watching. Laura Belgrave. Hi, Anita. I'm going to even tell you what she's saying, but Dr. Green, she says, please ask Dr. Green about thinning skin. I need only to brush against a door frame and, wait, I have to continue. This is how we're getting, okay. And no matter how lightly that occurs, my skin will tear and peel back. Bruising as well. Of course, at 66, this is terribly discouraging. Well, you got someone who really, this is starting to be, it's like talk radio where we took phone calls, now we take it this way. And I know Laura Belgrave, she's fantastic. She's an author, and tell her.
Hi, Laura. My suggestion is moisturizing. Moisturizing is one of the most important things someone could do for their skin to keep it thick, to keep it from getting too dry, from keeping it from getting too frail. So I tell people our skin is no different than a sponge that's on the sink. When the sponge is wet, it's thick. When it's dry, it's thin. So keep it moist. But the most important thing is sunblock when you're outdoors. And come join us at Broward Health North on Wednesday, June 20th from 5 to 6:30 for the free skin cancer screening. Because more importantly than just keeping your skin moist and thick, we want to protect people from having skin cancers or any serious skin cancers like melanomas. If we can prevent that and save some lives, that's what we're about, and we're trying to do to help.
Chris Noel is watching now, also you. And I think Chris Noel, I remember her. She was a singer, if I'm not mistaken, somewhere. But anyway, that's good. Well, it's great, and everyone can see how good looking you are, and they're listening to you. And so let's really get into what you said about the whole body scan. How do people get these moles on their back and even in other weird places? I mean, if they're not even in the sun, it's nothing to do with being in the sun.
So you can have a mole anywhere on your body. You can have a mole on your toenails, between your toes, on the bottom of your feet, where the sun just doesn't shine. So why we're looking all over on patients are because melanomas, which are the serious skin cancers that can actually cause fatalities, they can happen anywhere. Wherever you have a mole and the sun causes that mole to change, to become atypical. So I explain to patients, if they just get sun on their face and they never get sun anywhere else, that sun has radiation. That radiation causes cells anywhere in the body to change. So someone could have a mole on their toe or between their toes or underneath their tush, and the sun will hit them on the face, but it causes radiation to go throughout the body, and cells will change. So that's why a full skin cancer exam has to be thorough. We look people over top to bottom, between the toes, bottom of the feet, everywhere. Anywhere there's skin, we look. We look on the scalp, we look on the bottom of the feet, we look everywhere. So a thorough skin exam should be done once a year for the average person who never had a skin cancer, never had a pre-cancer. If someone has had a skin cancer, they should come in twice a year. And when I say skin cancer, I'm talking about the non-melanoma type of skin cancers. If it's a melanoma, they should come 3 to 4 times yearly.
So tell us about melanoma and what the difference is. I mean, you said something that could cause death even if you don't take care of it.
So melanoma, if you look at the statistics, one person dies every hour from a melanoma worldwide. Yes.
No kidding.
Melanoma can spread from an atypical mole becoming a melanoma, can spread throughout the body and have an increased fatality. Years ago, the diagnosis of melanoma had a 90% death rate. Now, thank God, we're having skin cancer screenings and a lot more skin cancer awareness. It's the reverse. It's a 10% fatality rate with melanoma. 90% of the melanomas that we diagnose nowadays, we catch early and they're treatable. So that's what this is about. And this is something that Broward Health North is doing, as well as myself in my practice. We're trying to be patient advocates, community advocates, educate the population, educate our community, and protect people. So skin cancer screenings, as well as free skin cancer screenings, are hugely important.
Well, let's just continue on this. Laura just said something else, but then she says thanks, so that was good. But do you use radiation? Let's say someone has melanoma. Are you using medication? Are you using radiation? What do you use to get rid of it?
So when we say skin cancer is a vague term. When we talk about non-melanoma skin cancers, there's multiple treatment options. But when it comes to melanoma, surgery is always the recommended treatment option, depending on how deep the melanoma is. Sometimes surgery alone, or sometimes there has to be radiation, and even sometimes we have to remove some lymph nodes, and sometimes chemo as well.
Mark Foley just wrote, and you're correct, Dr. Green. Former County Commissioner Dennis Kaler, let me just see this, Dennis Kaler had a small mole between his toes. He ignored and died of stage 4 melanoma. People do not realize the smallest spot can be a death sentence. And I do remember Dennis, yes. So, and Mark Foley was also, he was a congressman. There's
a famous musician that I think everybody here knows, Bob Marley. Bob Marley died of a melanoma on his toenail. So
I did not know
people
that.
don't think, well, I have dark skin or I'm African American, I don't have to get checked. But no, every single person, whether you're this skin type or that skin type or this ethnicity, everybody should have a skin exam at least once a year. It's a very important thing to do. And thank you for Broward Health North for setting this free skin cancer screening up to help save patients and help protect our community.
Right. Let me give that phone number again. Remember, Wednesday, June 20th, from 5 to 6:30 in the evening. They did that so that, if you work is no excuse. You need to come there anyway. And call 954-759-7400. You can visit browardhealth.org/events. And Broward Health North Comprehensive Cancer Center is right there, right off East Sample Road. It's a wonderful place. And I just have to say, and Laura just said, she's really doing this, she said, what exactly are basal cells? I've had 2 removed. Both were benign, but I don't really understand them.
So the 2 most common skin cancers, there's a basal cell carcinoma and a squamous cell carcinoma. All that really means is a different cell type in the skin becomes atypical and becomes cancerous. So the base of the skin is called the basal cell layer. If those cells become atypical, that is a basal cell carcinoma. That is the most common type of skin cancer. 80 to 85% of our skin cancers we diagnose are basal cell carcinomas. They're only tissue destructive. They usually do not spread throughout the body, so they're only destroying the tissue that they're around. Squamous cell carcinoma, which is the top layers of the skin, are called squamous cells. When they become atypical or cancerous, that's a squamous cell carcinoma, the second most common type of skin cancer. And that's about 15% of the skin cancers that are out there. And that one usually stays in the skin and it's only tissue destructive, but it can spread if you let it go too long. So these are the 2 most common types of cancers. Then about 5% are your melanomas.
Okay, and you said that in order to make sure that you know what it is, you do a biopsy. Does a biopsy hurt?
So the word biopsy, a lot of people get confused. They think it only means cancer. A biopsy means we just take a piece of tissue, send it to a lab, and they process the skin, and they look at the cells. You have very, very minimal pain when it comes to getting a biopsy. You get a little injection numbing the skin. It's like a scratch of skin. It's almost like a glorified paper cut, but we're sending that skin to a lab, and we're looking under the microscope at the cells to see what we're looking at, whether they're normal cells, atypical cells, cancerous cells. But the free skin cancer screening, there are going to be no biopsies. There's not going to be any procedures done. We're just examining people over. We're going to educate them, inform them of anything that concerns us or concerns myself, and I'll let the patients know.
And are there supplements people should be taking that help with this, or has that nothing to do with it?
No, I hate to poo-poo something, but sunblock is the most important thing. Supplements are not going to do the trick. Being careful in the sun, being cautious, being precautionary. Precautionary means wearing sunblock, avoiding the sun at certain times of day, not going out there to bake in the sun, to being responsible in the sun, and wearing sun protective clothing.
And when we walk our dogs, that's a very good example. 30 minutes and we're in the sun, aren't we?
If you're going on a long walk, whether it's for your dog or just to exercise or just to whatever you're doing outdoors in the sun, if you're out there over 15 minutes, you really should have sunblock on, and ideally put it on before you leave the house.
And a hat.
And sun protective clothing, a hat, long sleeve shirt, yes, protect yourself.
Okay, and tell us again the kind of sunblock we should get with the names and what people, because then we don't have to worry about 30 or 40 or 50.
I'm really not here to promote a specific brand, so it's not the name that matters to me. You turn the bottle around, you look at the ingredients. The top first ingredient in the list should be zinc oxide or titanium dioxide.
Okay. And
those are physical blocks that will protect you from the harmful UVA
good.
rays.
Well, we want to do that. So Jason Green, Dr. Green, before we end this, we still have a little bit of time, but I want to ask you a question. Why did you decide to become a dermatologist? You could have been anything.
So I was in medical school, and I realized that I love interaction with patients and building up relationships and getting to meet them, their family, and have them for many years. And I like to talk, and I like that dynamic. I like outpatient centers. I like healthy patients. I like to keep people smiling and happy. And I have a cousin who's a dermatologist, said, hey, come work with me for a couple of days. So I did, and I started realizing that I love what dermatology is all about. It's a very visual field. You make the diagnosis with your eyes, with your hands. You get to do procedures. And I started doing it. I started loving it, and I fell into the right field. I got very fortunate.
What do you think an elder dermatologist had to go through compared to what you get to do? I mean, it was very different then, wasn't it?
I think it's no different than an elder person versus a younger person. There's more technology out there. Things are evolving, and there's more.
Give us an example of some things that are evolving.
So they are in the process. They just came out with new ways to diagnose moles that are atypical by gene rearrangement. Think about what they're doing now on a cellular level. They're taking genes and they're splicing genes, and they're able to look at the DNA code. So what they've been working on for the last 10, 15 years, and they're still evolving, having computers make the diagnosis of atypical moles. We are now doing a procedure to get rid of skin cancer without cutting, and that's cutting edge. No pun intended. I mean, people don't have to get cut on now when they have a skin cancer. So they're working on pills for melanoma to keep people living longer who have terminal melanoma or melanoma that has spread throughout the body, metastasizing. So things keep changing. So the younger generation, there's more to educate them with, more understanding of things. I mean, this goes all the way back to the concept of years ago. They thought the world was round, and now that we know, they thought it was flat, and now we know it's not. Or our knowledge of space, and things are evolving. It's amazing, and the technology keeps improving our way of life.
And I, of course, often see advertisements for getting rid of all that fat, and it's done through, now actually it's not always done through a dermatologist, which it should be. I also see just centers doing this, and I don't know how they get that right to fool with things like that. They're lasers. Lasers have come and made a big difference, hasn't they?
I think it's very important to know who's treating you, to know their qualifications. Ideally, you want to go to a board-certified doctor who specializes in whatever field you're getting treated. If you're going to get your teeth treated, you go to your dentist. If you get your car fixed, you go to the car mechanic. If someone's going to do something on your skin or anything going with skin rejuvenation, the skin, the fat, the reshaping of the body, you want to deal with someone who works on the skin, a board-certified dermatologist. So I think it's important in life to always go to your specialist and have trust in your specialist, but to know their qualifications.
And for years, people would go to plastic surgeons because that's really how they got their face changed. But now there are a lot of procedures and things that you do, I know, that are much more simple, and you don't have cutting. So this must be exciting for you.
Well, the word plastic surgeon is a surgeon. They cut. So nowadays people get the luxury or the opportunity to get things done without being cut upon. So we call it non-invasive procedures, and we do tons of non-invasive procedures, whether it's lasers, whether it's body contouring, or there's a million things out there nowadays that we can do to improve one's skin. And I look forward to helping patients do non-invasive procedures that don't have to go to the knife.
Great. Well, it's been wonderful. I'm so glad you said so many things, and I really thank you very much, and we'll have to have you come on again. Thanks, Dr.
Anita, thank you very much for having me. It's an honor that Broward Health North is allowing me to provide a free skin cancer screening as well. Thank you so much.
You're welcome. Remember to call 954-759-7400 to make a reservation for Wednesday, June 20th from 5 to 6:30. Thank you.